So we're going to be talking about innovation in healthcare. Now, before we get underway, let's get one thing very clear, and that is that everybody in this room is an expert. You wouldn't be here unless you were. So we actually want to hear from you as much as you want to hear from us. So we'd really like to have an interactive discussion. We're going to ask a series of questions, make a series of comments from the podium, and then we'll open up for some discussion, and then we'll come back with some more discussion from the stage and finish up again with some opportunity for audience interaction. So get your questions and comments going, please. We really do want to hear from you, and I think we'll all enjoy this session much more if it is interactive. So, to kick us off, Ali, you are innovating in the area of precision medicine with a view to making it more accessible and affordable for everybody. So please tell us about lifespin.
Hello, good morning everyone. At lifespin we are digitizing blood. How does it work? We take a blood sample from a patient, we scan it within a magnetic field, and then we can obtain quantitatively hundreds of metabolites which are in your blood, which are representative of your health status. We are developing AI-based software algorithms which can detect disease-specific metabolic signatures. We have about 300 diseases in our proprietary database, and now we are launching subsequently our initial products. And how exactly does it work? First of all, the metabolism provides a direct insight into your health. So when you can look into your metabolism, you can basically look into your health. What's important is, in terms of personalized and precision medicine, that many solutions which are commercial today are too expensive for widespread use. But on the other hand, you can only have population-level impact if you have affordable and scalable solutions. And our strategy is basically to team up with local health system providers and laboratory chain companies in different countries in the world, and to enable these partners as scaling partner by making our software algorithms accessible. The patient logistics will remain always locally. Because of that, the cost structure can be extremely low. And I will give you a keynote actually later this afternoon at 2:30 about stroke, where I will present in more detail what exactly we are, or how we are achieving this.
Okay, Dominique, you work and live in the world of well-being and lifestyle. Tell us about innovations there.
Yes, thank you. Can you hear me? Yes. Good morning. I'm really happy to be here with you all. And David, just as you said, it is so interesting to see where we are on this day in terms of lifestyle. And it is actually crazy because I think most of you know the statistics, and I'm not going to give a whole presentation on that, but just briefly. We know, for example, now that 2/3 of all diseases worldwide are caused by lifestyle factors. We know, for example, too, that healthy lifestyle can prevent disease and actually lower the risk of chronic disease by 78%. So statistically, we could talk about a lot of things. And so clearly this has led to understanding the importance of lifestyle medicine. And David, that is the innovation. The innovation is really lifestyle medicine as its own actual area within healthcare. And maybe you have not heard of this expression, but lifestyle medicine formally organized in 2004, and only just a few years ago, we now have the Global Alliance for Lifestyle Medicine. And so within that scope, there are lots of innovations happening as we speak, particularly tied to digital and mobile health. I think if I ask you, maybe I ask you if that's okay, which one of you wears a fitness tracking device or a watch? A lot of you, exactly. These are all part, of course, of the innovations within this landscape. And so one of the projects that is emerging in just the last year or two, as data has been collected over the last 5 years, is a project, an innovative project within lifestyle medicine called the LIFT project. It aims to lift 10 million lives around the globe for better health and well-being. And so I'm very delighted to be a part of this landscape, because this innovation is transforming lives on all areas of health and well-being. So as we talk about, you said well-being, of course that includes not just physical well-being, but also social, emotional, financial, etc. well-being. And so the LIFT project is a holistic approach to lifting lives, to preventing disease, and of course, as it results in also a much lower cost for health and healthcare system. So this is one of the key elements, and so I'm looking forward to talking about this more.
Thank you. And that's a good segue over to Prashun, who's going to talk to us about health promotion. What's happening in terms of innovation in health promotion, Prashun?
Thank you, David. Hello. Can you all hear me? Yeah, thank you, David. My background goes into, I'm into healthcare, managing hospitals as an administrator, and definitely incorporating this new innovations coming into every day into the business. That's the biggest challenge, what we are doing. But today, if you see, COVID has taught us a lot of things in terms of innovation into healthcare. The first thing that comes is the telemedicine. You know, telemedicine has made us reach to the remotest place with the specialist doctors giving treatment. Even the adoption of mobile for various kind of awareness programs, self-tracking, and connectability of mobile with wearable devices, which Dominique just mentioned. Like most of us are today wearing wearable devices as a health tracker, which is again connecting to mobile data for us and for the others also to understand. This was not there earlier, and this is something which is catching up enormously in today's world. Next is the artificial intelligence and machine learning, which is churning out various data to understand patient profile and adaptability, and what Ali just mentioned about adaptive medicine. So these are the various things which are coming up in innovation, and I feel innovation, a continuous innovation in healthcare by all the industries, organizations is very important, because otherwise you become redundant in tomorrow's world if you don't catch up with the innovations that are coming up. If you take examples of several other industries, like if you see music industry, once upon a time we used to listen to music on cassettes. Then came the world of CDs. Then it was available. Then MP3 came, and we had music carried in MP3 format. And now it's available freely everywhere in the internet. So if the industry doesn't change with the technological advancement, those who have not changed will be left behind. So similarly, healthcare, whoever is in whatever practice of healthcare, needs to upgrade themselves, keep themselves with this technological advancement to innovate and adapt those innovations in their own business so that they can stay abreast. Thank you.
Thanks, Prashun. And now, Yasmin, you're a respiratory physician working in the area that has gained so much attention over the last few years, PPE. Tell us what you're doing.
Okay. Are you guys able to hear me? I have a very soft voice, so my name is Yasmin, and I'm one of the co-founders of Mawadda, as well as my co-founder over there, Furley Adam. We're both respiratory therapists, and we have founded our company, Mawadda, which is a modest medical clothing company. And we launched our first patent project, which is a disposable hijab. And kind of to give you a brief overlook on how we came about, as respiratory therapists, graduating about 6 years ago, going into our first operating room and being precepted, I remember my preceptor telling me, since we're going into an operating room, that it's sterile, to tuck my hijab in. So I'm going in as a newbie, trying to tuck my hijab in, and as soon as I get in, the nurses are a little bit more cautious, and they're telling me, tuck your hijab in a little bit more, and I'm doing that. So during the whole procedure and going over my skill sets as a respiratory therapist, I'm more cautious about my hijab and impeding my patient's safety and bringing an infection into the room. So by the time I leave out of the room, I kind of felt a relief, right? And that's when our coworkers and I, that are Muslim women that wear the hijab, kind of briefly talked over it. And as newbies, you're not thinking, let me create something, let me invent something, right? So we're thinking, let's just bring our hijabs in, a new one to the room each time we're going in so we can prevent that. And then we deal with more instances, just like going into a code blue situation where we are intubating, helping intubate a patient or doing compressions, and you have blood splatter all over you, and you don't have a new hijab to go into the next patient's room, and you don't want to impede that patient's safety. So we're calling our family, our friends, to bring us more hijabs. And then as we're trying to kind of put a Band-Aid on the situation, that's when COVID came. And during COVID, before you're going into the room, you're all gowned up, and then you enter the room, and we're dealing with high-intensity situations. We're dealing with trying to monitor the ventilators as well. So dealing with all of that and then leaving the room and ungowning and still having your hijab on, and then going into your next patient's room for the next 12 hours. And some of our patients are cancer patients, some of the patients are in the NICU, and we don't want to bring that infection over to the next patient as we're going in. So we had to tell our managers, like, can we not go into the NICU, because we don't want to bring that infection to the newborns. So as we're going about that, that's when my co-partner, Furley, and I went to start traveling as respiratory therapists all over the globe. And that's when you get to see new innovations, new ways of things being done. And that's when we've seen that there's like beard covers as we're kind of transporting one of our patients. And as we've seen that, we're like, if there's beard covers, why isn't there hijab covers? And we're like, you know what, let's start Googling it. So we're trying to see something we can buy so we can wear it. So we didn't see anything that we can buy. We saw a couple of stories. But that's when we took on the initiative to finally bring about disposable hijabs. And it's been almost 2 years, and we finally launched in November. And so far, we've had about 4 hospitals taking our hijabs, and about over 10 hospitals sampling it right now. And it's been quite the journey, but we're very, very grateful for it. Yes.
Thank you, Yasmin. It's a familiar story, isn't it? The I need this. Where can I find it? Oh, I can't. I'd better make it. Yeah. Okay, my turn. My particular expertise is digital health, and I see digital health as a meta-innovation in its own right. I see it as a paradigm change that we're only really just beginning to enter now. The time of digital health is still ahead of us. And let me use the example of today's virtual hospitals. We've had programs like Hospitals in the Home before, but today's virtual hospital programs are really belong to the digital age. And I'll reference a program from Australia, which is called My Home Hospital. Typically what happens there is that an emergency department or a general practice might have a patient that requires acute care. Once a referral is made, My Home Hospital arranges for the patient to be transported immediately back to their home. And while that's happening, a registered nurse packs a a large red box with medications, diagnostic, treatment and monitoring equipment, point of care tests, etc. Anything that looks as though it will be required for that patient, based not only on the referral but all of the information that's available through their electronic health record. A clinician then meets the patient at their home, usually at about the same time as the red box arrives via courier, and the clinician develops a plan for that patient and shows them how to use the mobile monitoring equipment to make sure that data gets fed back to the virtual care centre, etc. If there are visits required to other services, then the clinician also arranges those, the patient transportation for that. And what are the results? What's actually happening as a result of that service? Well, so far, cost savings are equating to between 19 and 35% compared with the same service being delivered in a physical hospital. So it's cost effective. The service has been accredited under Australia's National Safety and Quality Health Service Standards. So safety and quality is being provided as well, and that's being tested. But really importantly, the most important thing for me is that customer satisfaction levels with My Home Hospital are approaching 100% now that the service is well established. There were some opening glitches like with everything, but now the service is getting much better satisfaction ratings than the same services in a physical setting, using the same data capture instruments. And just to round out the service, clinicians really like it too. So I know that virtual hospitals are arising all over the world, and in fact there's a good example of one right here in Dubai. But the important thing is that there's much more boundary pushing to be done. And I think that virtual hospitals provide a really good example of person-centred healthcare innovation using the digital technologies that are now available to us. So there's a series of healthcare innovations that have some things in common, I believe. Not just that they're using new technologies, but also that they are increasingly person-centred. And that person may be the clinician or they may be the patient, but it's about person-centred and digital enablement. Now, I have a question. Dominique, how can it be the things you talked about comprising health, you know, social, emotional, mental, etc., that is pretty much the 1948 WHO declaration of what constitutes health. And yet lifestyle medicine is new? How can that be? Where have we been for the last 60 years? What happened?
You know, this is really the key question. I wonder that myself many times because the concepts in themselves are not new. We have known much of it already. But as I think many of us know too, it is the transfer from theory to practice that has been missing. And it has been missing in all areas, particularly when you look at medical education. If we were to study medical education, we will see that lifestyle medicine is not part of the curriculum. It's not. This is why this industry has emerged quite unregulated over the last 2-3 decades. That means we have professionals within lifestyle medicine that are not part officially of the medical community because it has been unregulated and not part of the curriculum. And so I see that as a very interesting interesting development. And so more and more, and maybe I can reference this, you may have heard of the Blue Zones study. It was a large international study, one of the largest there is, on lifestyle factors worldwide. And I believe that study, because it became so public through the media, actually launched this movement into becoming more organized. And so I'm very happy to see that, and that it's establishing its own discipline at this point, because I believe the time is now to realize the impact lifestyle has on health, healthcare costs, and like you said, on the person.
And you raised a great point, David, about the WHO definition, because what was not defined was what is healthy. So what we have done at Lifespin is we have taken 90,000 actually samples from healthy individuals, 40,000 women, 45,000 women, 45,000 men, from age 18 to 70 plus, which have been healthy. So we got these samples from a blood donation organization, actually, and we have digitized all of these samples. We have quantified the metabolic changes over age. Now we have a baseline of healthy. I hope that we all are healthy, but we all may have a different age, different biological sex, whatsoever. But healthy is a range. It's a continuum of different conditions. Now, when you have captured this continuum of healthy conditions, then you can start looking at pathological deviations, and then you can start looking at metabolic changes which are indicative of specific diseases.
Any other comments on this? No? Okay, I do have another question, this time from something that you mentioned, Prashun, and that is AI. Now, of course, just in the last week or so, we've had the European Union release its paper on the regulation of AI, and in the last couple of months, we've had some statements from very high-profile people warning us about the terrible dangers of AI. Any comment on that development?
See, innovation is the in thing, of mainly medical industry, which I believe is we have to keep up with it. Anybody we have to keep up with it. If you see in terms of the prevention, cure, and promotion, what has happened is in terms of cure, if you see, first there were surgeries happening, open surgeries. Then we migrated from open surgeries to laparoscopic surgery. From laparoscopic surgery, we have migrated to robotics. And tomorrow we don't know what is going to come. Maybe non-invasive laser surgeries are going to come. So we need to keep up with it. We need to keep up the technology, like IOI and everything, to embrace what changes are coming in the industry.
Okay. I think it's interesting and very sensible that the EU guidelines are based on risk. The difficult question is always, of course, whose judgment of risk and how do you quantify it, etc. Because innovation requires taking some risks. So it's always the where is the drawing of that boundary that's important. Anyway, now over to you. We'll be changing the topic a little shortly, but questions, comments about what you've heard thus far, or contributions about your own innovations in healthcare that you'd like to share? Do we have a microphone? Yep.
Can I please have a microphone here for the audience? Thank you.
Good morning. Thank you for the interesting discussion. I've got a question for Dr. David. You're telling us about virtual hospitals. I'm just thinking about it because I have not encountered one. What in case if a patient gets sick under the care of virtual hospital? Can all the medical data that you have in your virtual hospitals be transferred to the physical hospitals? Or how do you manage this patient now in a real hospital setting? For example, I'm just giving an example. If I've got a myocardial infarction and I need an angiogram, I have to be sent to the hospital. Am I right? Or do you manage that in your virtual hospital? No, right?
No, there are some tests that increasingly can be undertaken at the point of care. Okay. But if a person does need to go to another setting, whether it's to a hospital or to a diagnostic testing facility that has more advanced capabilities, then patient transportation is arranged so that the person can go to and from. So it doesn't completely remove a person from the hospital system. And similarly, high acuity patients are not left out of the program. If someone needs a stay in hospital, then that's a part of the plan. But they are stepped down from that physical hospital to other settings as soon as possible. So I guess the basic philosophy is that physical hospitalisation becomes a last resort rather than a first resort.
Okay. So the AI data that you have on a patient, in case the patient needs an hospitalization, could be transferred rather than the patient going into the whole lot of things. Okay.
Yep. So you just... One of the things about it and why it's now, as I say, a part of a digital health paradigm, is that we do increasingly have interconnection between various services. Now, I spend a lot of my time working on interoperability and standards and passing information around, but it's increasingly happening that you can move information around the system and you know far better that what a patient might need. Predictive analytics are used too to see what a patient's pathway might look like so that you can try to manage things and keep them away from a hospital as much as possible.
Any other questions? Yes.
Good morning. My name is Dennis. I have a question regarding AI. So you're talking about management mainly, but I have a question also about, would you consider AI-assisted medical decisions? For example, we've seen there is a huge delay and sometimes bias in diagnosing women-related conditions, and this is a huge problem, especially I work in the UK, and in emergency department, this is also quite a big problem sometimes. Would AI be an assistance to diagnose other health conditions?
Over to the clinicians in the
AI is, in the healthcare domain, AI is in a very nascent stage, and developments are definitely happening in AI, targeted AI. Hopefully, in very recent, we will have a proper diagnosis through AI, with the pre-information of patients. And that's not a very far thing. That's going to be a very near thing. That's what my belief is.
Thank you. And last question. Are you aware if anyone is actually implementing this at the moment, or it's just a project?
This is basically in project. Now, as per AI practice in hospitals for understanding patient parameters is not happening. This is still in a R&D stage, and hopefully we will get a very good result very soon on how to utilize the AI data for patients' treatment.
Thank you.
Thank you.
Yes. Can we give the microphone to the table just behind you, please? Thank you.
Thanks, David. So good morning. Hi, I'm Dr. Kenny. I'm from Malaysia, Sarawak. Thanks to the panelists. Thanks, Dr. David, for your introduction and this topic. Just a question to Dr. David regarding community hospital and with other panelists. The question mainly is the concept of community hospital. I'll put it nearer. Okay, thank you very much. The concept of community hospital is actually a very progressive mindset because you want to scale and reduce the workload, especially in tertiary centers, especially with areas with large infrastructures, limited infrastructure and connectivities. So you wanted to scale as much possible to people or person as possible. So what happened in Malaysia, we actually have a similar platform called Doctor 2.0, Doctor to Home, that they use a similar concept using an online platform that allows the community to access towards healthcare request for allied healthcare to go to their houses to get seek treatments, for example, nursing care. My question will be, actually, what is the prerequisite for Dr. David's hospital concept from a regulation perspective in order to allow the doctors to go towards the patient's house to deliver treatment to reduce the risk of negligence? Because what happened in Malaysia is the regulation are not allowing doctors to go out from a healthcare facility in terms of hierarchy assessment. So when we go out to a patient's care, community care, the issue we are facing is we do not have a benchmark to decide whether or not this patient are supposed to be treated at home or should we go send them to a tertiary healthcare, and how should we monitor them if we are going to deliver treatment. For example, are we going to give a IV cannulation medication, drips settings, or can we actually deliver it in the local setting at home, which is possible in Australia. So that are the regulation prerequisite that we hope that maybe Dr. David, you can elaborate further. Then I can actually share with my colleagues in my hometown. Maybe we can actually move forward to actually reduce the burden of tertiary healthcare facility. Another part will be actually, mainly is that part. Regarding the benchmarking of triaging, regarding the benchmarking of triaging, recently I actually went to Singapore, and what Singapore did is the Singapore National University of Singapore and also the Singapore General Hospital, they actually have a new AI system they developed for the past 3 years. They use a massive database system to actually recognize early symptoms. For example, by imaging, they actually can triage and knows that this patient is going to progress towards stage 3 or stage 4 severe lung disease. So using this massive data system, they actually progress further to actually use it for triaging and identifying patients that are actually going to supposed to be receiving a much higher needed healthcare, such as red zones, etc. So maybe from that perspective, I just want to contribute towards Dr. Davis' idea in terms of benchmark of triaging. We can actually build AI on top of it and create a system that allows a global database assessment so that if we were to go globally in terms of technology and in terms of global community health, this kind of application can assist the healthcare provider to assess at the point of care, to know that this is the benchmark required, and with the database is required that we should actually send them to the hospital instead. That's all my question. Thank you very much.
Okay, just a couple of quick comments. Firstly, regulation is obviously an extremely important topic, and one of the issues that I think everybody on this panel has probably encountered at some stage or another is that regulation is a slow beast, and it does take a while to catch up. And in fact, we've seen in many other industries that digital innovations sometimes skip well ahead of regulation, like in the transport space, etc. Uber, are Uber drivers employees or contractors? Many countries are still working that out. In health, it's a little trickier because we are such a regulated industry and need to be, because there are life and death issues involved. But I think the really important point you're making there is that you can't innovate without taking regulation strongly into account, and Ali will talk a little bit more about that in a moment. The second point, I think, is simply that, as I said earlier, the reason these new generation virtual hospitals are part of the digital paradigm is that they do have to be surrounded by a range of technology platforms and capabilities such as those advanced analytics, etc., that enable us to really take advantage of new care models. Now, we have to move on, I'm sorry, but let me just change the subject a little. Dominique, we've talked about some specific innovations here. Raising your telescope or looking into your crystal ball, what do you see a bit further out? What's coming that's really going to change health and wellbeing?
Yeah, maybe really tie into what I just said already. I do see in the very near future the, so to speak, slow marriage between lifestyle medicine and the traditional medical healthcare system. The certifications are now expanding quickly across the globe because they're now actually quality certifications in lifestyle medicine. So I see that becoming an integral part of healthcare delivery in all areas. So that's one thing that I see developing in this space. Another element is the entrepreneurship coupled with lifestyle medicine, because it is fast and impactful. It is reaching more people quickly. And so I see innovative entrepreneurship combined with lifestyle medicine, just as we've seen with the mobile trackers, etc. And there's more coming in that landscape quickly. And last but not least, I do also see one new factor being added to lifestyle medicine, and that is the environmental impact. The pollution that we see through the world that we live in, through the food production, through technology and everything, that is becoming such a big element within lifestyle and healthcare that I see that evolving and merging. So those are three areas I see within lifestyle.
One important aspect is, I think, standardization, especially when it comes to new technologies, but I think also about lifestyle. You can speak to different experts in different parts of the world, and you may get sometimes different answers. And I think one important aspect is to really ensure guidelines for standardization, because only when you have standardization, then you can really actually compare impact of different things on health in general. Second item is, when it comes to the regulation, only when you have standardization, only then it can become accepted by the regulators, and only then you can really promote it in a, let's say, high impact fashion. Otherwise, if you, for example, read the FDA's, the US FDA's lifestyle wellness guideline, it's just a 9-pager, which tells me that there's not really much standardized, which is, I think, a huge opportunity to standardize it in a sound and solid fashion, that regulators will become more amenable to that, because only then you can really disclose high quality information in the medical context, and only then, now comes the important part, the payment, only then you can attract payers to really reimburse it, because from my perspective, the, let's say, regulators are not really such a huge challenge. If you basically deliver what you promise, what you should do no matter what, that's straightforward. I think it may take time, but it's straightforward. The more important question is how to convince payers, independently of the national payment systems. Important is to convince payers, insurance companies, corporate health programs that these tools are really useful. Only then will we get mass adoption.
Ali, can I ask you about clinical politics? Let's just call it that. So, for example, in Australia during the COVID epidemic, we had, or the pandemic, we had a number of telehealth operators that were new to the market. And our medical colleges lobbied to the government to have them closed down. And the reason they gave for that was they said they were providing poor quality care. Yet, interestingly, the people who were providing the care through those telehealth providers were in fact the same people who were doing the same thing in other general practices, etc. So the suspicion, the strong suspicion from me anyway, is that what was being closed down was a threatening business model, and safety and quality was being used as a front. Do you see any similar things in your experience in innovation in the medical world?
I mean, health systems or the healthcare value chain in general is dominated by incumbents. Now, the question is how to overcome the domination of the incumbents, not the incumbents. They are all fair and solid, right? The question is more how to overcome the domination of the incumbents in healthcare. This only happens, I think, if you show impact. That means if what you show is truly useful, because then there will be a pull on the market side. I'm always a big believer in the market. What does the market want, right? That's very important to understand that. And, you know, technology is sound and solid. It will happen at the end of the day. It's a bit painful in healthcare, right? It's not like getting a new PlayStation out and people will buy it because it's just available. It's a bit more tricky, and that's why I'm saying it's so important to work in a standardized fashion, to work in a comparable fashion, that then you can really convince people with data and not with politics.
Great answer. Prashun, we don't want to make it sound like innovation is easy because we know it's not. Maybe it is for one person in 1,000, but for the rest of us mere mortals, it's a hard slog. What can you tell us about how organisations can become ingrained and sustained innovators?
See, firstly, we have to understand innovation is not only technology or digital. It is a mindset. It's a culture. So every organization first should draw up their mindset to change. First, understanding that we need to change, we need to innovate is the most important thing. Secondly, what is very important is to understand what kind of new innovations is going on, happening in the world, in different other industries also, so that we can adapt them in our own organizations. Thirdly, that is very important, is to collaborate and have partners, because not that we are experts of everything. So we need experts in different domains to collaborate with us to walk into the path of innovation. Once we have done that, then we need to design innovations, understand what kind of innovations we need to do, and once that is done, we need to upgrade the skills and training of the people involved in the organization to innovate. And we don't have to forget, the most important thing lastly is keeping the innovations as per the regulatory norms, as per the security norms, as per the policies of the industry. So all this put together, like it's a culture. What I say, it's a culture which needs to be embraced by all the organizations to float above.
Thank you. And Yasmin, sorry to drop this question on you, which I hadn't told you about, but just comes out of what Prashun was saying. In your experience, very recent experience of innovation, what advice would you give to the innovators out here?
My advice to everybody is understand,
Sorry, I was asking Yasmin. Sorry.
The advice I would give is that to believe in yourself, number one, and have a purpose behind your innovation. When you have a purpose behind it, you're going to seek to find the solution in it. And to also know that to get help when needed, that you're not supposed to find all the answers by yourself. Me and my co-founder got our FDA approval by ourselves. And it took us a long time. Had we known there's consultants and there's help that could be given, it would have made the process a lot faster. So I would say have a purpose, be driven, and know that if there's a need in the environment or in the system and you have the solution for it, go for it. Yes.
Thank you, sage advice. So we've got time for one question, and here on the in the front.
Sorry, I thought the microphone was...
Thank you so much for your panel discussion. I've been listening to you, and I've been thinking the whole time. Innovation starts from the very high point, right? So what about the patient? I mean, I'm just thinking, what advice will you give me right now when I get home tonight to get to my patient and tell them, this is what you should do and this is what you should not do? So I've been missing that in the panel discussion. Can you just help me with that, please?
Okay. Sorry. Could you just repeat the question?
Okay. I've been listening and I've been wondering, okay, I think innovation is very, very, very good. However, I've been missing just one probably crucial part, and that is when I get home tonight, how do I get to my patient and tell them about lifestyle medicine, for example? I've been missing that. So if you could explain more, please. Thank you.
Yep. Prashun, do you want to just make some comments? What practical things can the audience here take home tonight?
I'm not very clear about the question, but still I will try to answer what you are asking for. Is what would you like to take away from here from this session? Am I correct? At the end of the day. So the most important thing is innovation is very important for any organization to survive, for any human being to survive. Understand what is happening around you so that you can adapt those innovations within you. Maybe it is individual, maybe it is organization, so that you keep on innovating yourself and move ahead. That should be the main takeaway from today. Could I answer your question?
Okay. At time. Oh, sorry. Yes.
Yes.
Last comment.
Sure. So your takeaway for your patient is what you asked. So patient satisfaction is very important in the hospitals, and especially with the disposable hijabs that we've created. Listening to your patients, the need is within the patients as well. Especially with our patients that go into MRI, my co-partner had a family member that she assisted to go to MRI in the United States, and they gave her a bed sheet to wear on her head when she asked for a sterile hijab. So asking your patients what is the need, that is the gap in the system, that you can assist with them too. So we can be able to figure out what other gaps are in the system too. So, yes.
Okay. Thank you. I'm sorry we have to truncate the discussion now, but our time is up. Please thank our panel.
Please put your hands together for this incredible panel. Thank you, David, for moderating. It's very interesting to see how healthcare and the digital landscape are converting, even more so with lifestyle medicine. Thank you very much, panelists.